good afternoon, good evening, whatever zone you're in. I hope you're having a good time. I think it's about to get better. And it's noon on the eastern coast of the US, so we're ready to start today. Welcome to the third annual MIRL Symposium. My name is Stephen Moore, and I'm a librarian at Henry Ford Health in Detroit. And on behalf of the Planning Committee, we are so thrilled and grateful that you've joined us today. MIRL stands for Medical Institutional Repositories in Libraries. And the MIRL Symposium is a free annual event that is held virtually as a way for librarians and library staff in healthcare settings who are involved with their institutional repositories to gather and discuss topics that are relevant to their unique roles. This is the third year of MIRL, and we are really excited to keep this community going strong. Members of the MIRL Planning Committee published an article in the July issue of JMLA titled "The MIRL Symposium, a Blueprint Designed in Response to a Community of Practice Need," which is linked on our homepage. MIRL is also a proud recipient of the 2023 Gene Williams Sayre Innovation Award from the Midwest chapter of MLA. And in addition to a recording of today's symposium, the MIRL homepage will soon feature resources for IR managers, such as Beginner's Toolkit. So be sure to check our homepage. We may have more resources available, other opportunities for engagement, or maybe another award to show off. MIRL continues to be fortunate by having attendees and presenters attend from all over the world. So we have over 400 registrants this year, including folks from Canada, Mexico, Jamaica, St. Kitts and Nevis, Antigua and Barbados, Spain, Croatia, Italy, Greece, Qatar, South Africa, India, Australia, and 90% of the United States. We'll get you one day, Wyoming. Just a couple of WebEx tips today. We are recording all sessions unless the presenter requested otherwise. Those will all be available after the event, most likely after Thanksgiving. You can check your email or visit the MIRL website for an update on that. We are using the same WebEx link all day, so if you need to come and go, just use that same link. If you're posting to social, please use the hashtag MIRL23. All attendees will be muted without video, and I do have the ability to mute all panelists, so just keep that in mind. Please enter any questions into the chat, either as you think of them or during the Q&A portion at the end of each session. If you're having audio trouble, there's a telephone number available as well. You can call that, and it may resolve the issue. At the end of our event, when you leave the webinar, you should see a survey pop up. If you wouldn't mind completing that, it would give us a good idea of how we should approach next year. So we're trying something new this year, and instead of a keynote speaker, we invited 5 library leaders to participate in a panel. We're really excited for the upcoming discussion, and we hope you are too. Following our panel, we'll take a short break, and then we'll begin our presentation sessions for the day. We'll take a 10-minute break in between each sessions, although I think one of them may be only a 5. 10, 5, 10. But we'll close by 5 o'clock, so our Eastern time zone friends don't have to stay too late. Lastly, I would like to thank the very good people of the MIRL Planning Committee. I'm incredibly grateful for all of their hard work and ability to have fun while we work. Our planning committee is Lisa Buda, librarian at Rochester Regional Health, Anthony Della Furicchio, data librarian at Memorial Sloan Kettering Cancer Center, Brenda Fay, library manager at Advocate Aurora Health, Sarah Hoover, metadata and scholarly publishing librarian at the George Washington University Himmelfarb Health Sciences Library, Ramona Cavilius, collection development and special projects librarian at Galter Health Sciences Library and Learning Center at Northwestern University Feinberg School of Medicine, and Lisa Palmer, the institutional repository librarian for the Lamar Souter Library at UMass Chan Medical School. My colleague Brenda will lead us into the panel presentation. So Brenda, I'll stop sharing my screen and you can take it away.
Okay, thank you, Stephen. Can someone let me know if you see my slides?
Not yet.
Not yet, Brenda.
Okay, sorry.
Okay.
All right, sorry about this. I had my thing all set up and before we